Hello, everyone. Welcome to this edition of Parent to Parent, where we talk about all things really related, not just to parenting, but something just as an adult that you may be experiencing. And today I'm going to talk about one of the things that I really don't like doing at all. And it isn't even because, I have a wonderful dentist, but I don't like anything when it comes to my teeth. I know there's a lot of people like that, but it is so incredibly important to get your teeth checked, especially nowadays. And I've been learning all this because I went to my dentist recently, and it's something that people do put off a lot. I was just reading reports on how much people put this off because they think, oh, well, nothing's really hurting, so I should be just fine. Or they might not be brushing their teeth as much, like they're supposed to be, or brushing in the right way, which I learned as well. So say you had a cookie and you're about to just going to brush your teeth and go to bed. Well, I learned you have to wait at least 30 minutes before you do anything like that. So there's so many things. And the other thing that was so super concerning to me is the fact, well, first off, February is, I believe, one of the months to raise awareness for children and their oral health, but oral health is such a big deal. According to the AAPD, tooth decay is the number one chronic infectious disease among children in the United States, which is more common than childhood obesity, which you hear about so much on the news and the headlines, diabetes, and asthma. Dentists are sounding the alarm because 51% of children between ages 6 and 11, can you believe that, have cavities. Yet many families just don't realize that tooth decay is totally preventable. So from the middle of her day, here she is, the Texas tooth lady. I'm going to bring her in, Dr. Terry Alani. Thank you so much for being here.
You're welcome, Rashi, and you're not the only one that doesn't like going to the dentist.
It's nothing against the dentist or the hygienist or it's just the whole process. But, just what do you tell those patients when they say that? Because how important is it to go regularly?
All I can say is dentistry is not expensive, neglect is. So it can be a fairly pleasant process if you're just coming in to get your teeth cleaned. It's not painful at all. But if you procrastinate and wait, you might have to have a deeper cleaning. You might have to have a cavity filled. It becomes a little bit more laborious process.
Definitely. I mean, maintenance is key. And I've learned that the hard way too, through my years of using my teeth. I guess that's what I would say. But, it's you can either go 4 times, or was it 3 times a year, 2 times a year? What do you recommend for people who really just try to put it off? Is 1 time a year enough?
No, 1 time a year is not enough. The American Dental Association recommends twice a year. Now, some patients actually need to come in every 3 months or every 4 months, depending on their ability of accumulating tartar. So it really depends on each patient. So it's not one size fits all, but once a year really is not recommended.
And can we talk about oral health? Because it is becoming more and more of a concern. And when we were talking, you were saying, especially because of the pandemic.
Exactly. So what we've seen as a result of the pandemic is there are more fractures. People are breaking their teeth because they're so incredibly stressed out. You see more acid reflux, which causes erosion on the teeth because they're stressed out. A lot of people have had an increase in tartar and gum disease because they haven't been able to go to the dentist, and maybe because of anxiety or whatever, they've neglected their dental care. So we see a lot of these things. Also, if a patient has high blood pressure, if they have diabetes, all of that affects their oral care if they're not able to get the prescription filled. All of that, the pandemic, we've totally seen an increase in more patients coming in for cavities because of all the sugar that they're taking in because they're stressed out. So the pandemic definitely increased the treatments that we have done for our patients.
And it was interesting because you were talking about also gum disease and people clenching their teeth. It just seems like I know I'm one of those that clenches their teeth, but, and then talking about how that's become more prevalent and also getting the right mouth guard.
Okay, so definitely, I would say probably about 60% of the population, especially adults, need to be in mouth guards, especially if they had veneers or any type of extensive dental treatment. But a lot of people, I know I do, I grind my teeth at night. We're not aware of it. So you need to have a custom made mouth guard. Now, it's not one size fits all. You do not want to go the grocery store or the drugstore route and get one that is, you just boil it and then just put it in your mouth. It has to be custom made and custom fit for your particular mouth, especially if you have dental implants. You want to protect those. So that's going to keep your teeth from hitting each other at night, and it will keep them from cracking and breaking.
And does that usually get covered with insurance, or it just depends?
Many times night guards are covered. It really depends on an individual policy, but most of the time the insurance will cover the night guard. And believe me, it's a small price to pay to prevent any long-term damage.
It definitely is. I wear a night guard. I should be wearing it more often, but you know, when we wake up and your jaw is hurting so much. I mean, I think it's like, I read like 300 pounds that the pressure that you're putting on your teeth. And so then what happens with bone density? Because that's also related to it, right?
Well, believe it or not, we now can inject Botox into the masseter muscle. We inject it right into the cheek, and it actually will work for about 3 to 6 months and totally relax. So we're doing that now for big clenchers and grinders.
Wow.
So as far as affecting the bone density, that's not really an issue. Bone density really has to do with people going through, women going through menopause as we get older.
Okay. Yeah. And I'm going to show you guys this video. It's kind of crazy. I had this done right here, and I don't think we can talk during the video, but do you want to explain first off what we're going to see?
Sure. Describe the video to me.
It's the one that we took when you were doing the oral.
Okay. So basically, oral cancer kills one person every hour in the United States. And we definitely recommend an annual oral cancer screening for anyone over 17 years old. We use the Velscope. So the Velscope is a special device that actually highlights suspect areas. And these areas are highlighted. If we see them, then we can refer you to the proper doctor for a biopsy and to see if that needs to be investigated further.
All right, let me see if I can play it with you talking, or both of us.
When?
You want me to record it?
Okay, go ahead.
I don't think she can record it. You want her to?
I think it'd be good.
Okay. Let's hang on. Let me get this. Say
throat.
There
we inspect the sides, underneath the tongue, and the whole entire area.
Okay. And I mean, you were telling me examples of how people have had, like, healthy people, and they've had this, cancer in their mouth and they didn't know about it. I mean, give me those examples, because it really startled me.
Exactly. So believe it or not, I've diagnosed about 5 cases in my years of practice. And there are people that don't have risk factors. Your risk factors, of course, are going to be smoking, chewing tobacco, alcohol. These people had no risk factors. There were 3 women, 2 men, and one was on the side of by the tooth, at the root of the tooth. The other one was on the side of the tongue. The other one was back of the throat. I mean, they're just various areas. And one thing I do want to point out is that HPV through sexual transmission is 5 times the incidence as it used to be for anyone under 40. So we recommend an annual oral cancer exam for anyone 17 years and over. And I recommend highly the HPV vaccine for these young children. Not children, but they're teenagers, because it is through sexual transmission and it is on the rise. I believe Michael Douglas, the actor, that is the type of oral cancer he had. So we're trying to draw awareness to that. And believe me, a lot of patients will come in and it's a very minimal cost, but you want a negative result. Mm-hmm. Like with a mammogram, you want a negative test. So it's definitely worth it to have it done annually.
It definitely is. Right. And I mean, it's things that you wouldn't even think about. Like, you were looking on all sides of my tongue. I mean, it doesn't feel like anything, right, when there is something there. But it's just good to get checked out, because sometimes it can be spread quickly.
No, right. So basically, Rashi, what happens is if you have a sore that hasn't healed for about 2 weeks, or you have an area that just looks discolored and hasn't changed, you can actually do like an oral inspection in your mouth as well. The back of the throat, possibly not, but you definitely go to your dentist and have them aware. because it's really important, because if it's caught early, you've got about a 90% survival rate. But the reason you have such a low survival rate is a lot of these go undetected for a long time. So early detection is the key.
So a lot of our viewers either smoke cigarettes, marijuana, drink a lot of alcohol. Obviously, that's not good for your teeth. But what are you seeing more and more of when it comes to the type of decay or effect that kind of behavior has?
So the worst thing are people that drink a lot of soft drinks and juices, because basically a bottle of Coke, a can of Coke, has enough sugar is a cup of sugar. Okay, the same. So that's a lot of sugar. And what you're doing is you're basically just bathing your mouth in sugar. So what you see in these patients, especially in teenagers, you see decay in between the teeth that is not visual if I'm looking in their mouth. So that's why we take the x-rays. It's really important. So the decay is between their teeth and it can spread very rapidly. Sugar is the worst thing for your teeth. So I tell parents, don't put your child to bed with a bottle only of water, not milk, not juice. Your children, limit their snacks to a specific time. Take away the juice drinks, unless they're going to drink it very rapidly, and then you wait 30 minutes to brush your teeth. Make sure any type of sugared candy. I really limited my kids, and I've been fortunate they don't have any cavities. And also, you want to make sure you're on a fluoride toothpaste. I know there's a big controversy with fluoride, but it's very effective in preventing decay. Take your child to the dentist twice a year. Once they turn 2, they're ready to go to the dentist. And one thing that I do recommend is for parents that are having a difficult time, their kids brushing their teeth, take your child to the store with you and have them pick out a cool toothbrush. That seems to always help because they become involved in the process. Make sure when they're 6 and over, it's just a pea size, or even really 3 and over, just a pea size of toothpaste. You want to monitor that. But the main thing really, Rashi, is the diet. Even people that drink a lot of alcohol has a lot of sugar in it, right? So you're going to get a lot of decay. I can always tell patients' diets by looking in their mouth. And the problem is this plaque sticks to your teeth, and then it turns into tartar, and then nobody can get it off but us. And then they come in, and I will tell you something else. Healthy gums don't bleed. If your gums are bleeding, they're not healthy. You need to come and see us.
Yeah. No, that's I'm glad you brought that up. I mean, it's hard because a lot of these like kids' birthday parties, which I know your kids are older, but like, they have the pizza and the juices and so like it's hard because you don't want to be like, no, don't, have that, because it's not a once in a while thing. These happen, with school functions, things like that. So it's so prevalent. And I think that might be one of the causing factors of just, oral health in kids declining, especially with obesity and what you eat. And especially like fast food restaurants, like they have the apple juice, but it's not the apple juice with no sugar. It's, so one of the things that I do, parents, which I just recently started doing, is every Saturday we juice. I got a juicer. And
I have one too.
Yeah. And so, but like I get them involved too. So they cut the apples. There's like these like kid friendly knives. They're plastic. They cut the apples. So we make our orange juice or in our apple juice.
That's
and
a great idea.
I feel like next level adult there because I'm like, whoa.
So the thing is that you hit the nail on the point. Look, your kids are going to drink soft drinks out. They are. Right. You don't want to make it a habit. You want to educate your kids about what sugar can do to their teeth. And so you don't want them chewing sugared gum. Now, believe it or not, sugar-free gum with xylitol actually helps prevent decay.
So what are like examples?
I like Trident. Trident's got xylitol. It actually helps prevent decay. So that type of gum is okay. But like sucking on mints, jawbreakers. Jawbreakers are so strong they can actually crack your teeth. Oh, wow. The other thing I want to touch on is sealants. So it's really important for your children when they go to the dentist to get sealants. They put the composite filling. It's this little filling material that just flows into the crevices, so it will keep food and debris from getting into those crevices and causing decay. And sealants is one of the number one preventable ways that we can actually prevent our children from having cavities. But basically, Rashi, diet is the main nutrition. I mean, if you have healthy nutrition, you're going to be healthy. And your gums are going to be healthy. Your body's going to be healthy. Your heart's going to be healthy. So it's really teaching your children healthy habits from the ground up.
Do you have any tips for parents who are trying to get their kids to brush their teeth by themselves? I mean, I have done, my son will now brush his teeth by himself, like, because he picked out his toothbrush. Like, it's like a Captain America.
Exactly.
So, but I feel like it's so much easier sometimes for parents to be like, okay, don't brush your teeth. It's fine. Don't, and I hear that a lot from other parents as well. So are there any tips to getting your kids to brush their teeth twice a day and do it by themselves?
I bet you, because I see more adults in my practice, but I bet there's an app. I bet you there's an app. Everybody's got a phone. I bet you there's an app. You can get some type of little device that monitors 2 minutes with the song. Maybe have a little reward jar. They brush twice a day for whatever. Put whatever. I don't know, a quarter. I don't know what people put in.
Do you give that advice to adults too?
I don't know if the going rate is for the tooth fairy either. I know it's more than a quarter in my day.
I know.
But basically, just try to encourage them and make it a fun exercise.
Yeah.
Nobody likes really brushing and flossing. I mean, I'm a dentist and I don't really enjoy flossing that much. But I think with your kids, there's also flavored toothpaste. So get them something that they like, right? Have them pick it out, have them be part of the process.
Yeah.
And I think you can teach them healthy habits at a very young age.
Definitely. Well, is there anything else? Well, the last question I had is why wait 30 minutes?
That's a great question. Okay. So for the adults that drink wine, when you eat breakfast, you drink coffee. A lot of those are acidic. So that acid will stay on your teeth, and you want to wait 30 minutes for your saliva to neutralize the acid. So you're not harming the enamel of your teeth. So wait 30 minutes. When you wake up in the morning, you can brush your teeth right away. But if you're going to eat breakfast, you want to wait 30 minutes after you eat before you brush your teeth. And that's a really important concept. And I'll give you another hint. With coffee, for anyone that doesn't want to have stained teeth, I drink coffee through a straw.
Oh, how do you drink with your straw?
So when I drink with my straw, I sort of put it in the back. I usually use a styrofoam cup, right? So it's one of those cups. I put the straw in it, and I just drink through a straw. I mean, it's hot, so you have to be careful, but it goes to the back of my mouth, so I'm not getting stain in the front of my mouth.
But are you doing it the side of your mouth or like right here?
I usually put it like sort of towards the side,
Yeah.
No, not actually to the side. Yeah, a little bit. I mean, you just got to be what you're comfortable with. I never think about those things, Ron.
Well, no, I know, but I was going to tell you, Dr. Alani, because I learned that, with like smoker's mouth, like because they purse their lips together like that, it causes more wrinkles versus doing it on the side because you're not doing that.
This is true. Exactly.
So that's why I was asking about how you do it. I usually go like this, with the straw, and like now I do it to the side.
No, that's very true. So to the side, that's the answer.
So to the side to make sure our lips are good. No wrinkles. Well, Dr. Alani, I really appreciate your time. It's already been 20 minutes. Can't believe it. But one of the things we're going to talk about, which is huge and very popular, especially with Zoom and TikTok and all of that, is whitening your teeth. So there's so many over-the-counter things you can do, toothpaste. You can go to your dentist, get it done professionally. There's people that say that they have a treatment for $50. So what's the best thing to do? What risks are there? What should you look out for? So that'll be a whole nother segment that we'll be doing pretty soon. So you'll have to wait and see for that. Dr. Alani, did you want to say anything else?
No, just remember, floss only those teeth you wish to keep.
That's great.
You'll be true to your teeth or they'll be false to you. That's it. Don't be afraid of us. We're nice people.
They are very nice people. All right. Well, if you are looking for a dentist, Texas Tooth Lady, here she is. This is her website, so you can go there. And they're great over here. They're in the Uptown area. Did you say Uptown area or Galleria? Galleria area. Yeah. Wonderful there. So thank you so much, Dr. Alani, and look forward to talking to you again.
Keep up the good work, Rashi. Thank you.
All right. Thank you.
Bye.
And thank all of you for joining us in this edition of Parent to Parent. So awesome. Dr. Alani was able to talk to us. She's a phenomenal dentist. And, it's something that we do every day, eat, drink, and we just need to take care of our teeth. It's hard for me. I know it's hard for you probably, but we can all do it together.